everybody, I'm Lacey from Fayetteville Pelvic Health and Wellness. I had a request to do a video for SI joint dysfunction. SI joint is our sacroiliac joint. It is where our sacrum, which is that triangular bone at the very bottom of our spine, meets our hip bones. So those big fans of our hips, there's two joints, one on each side, that form our sacroiliac joint. There's not a lot of movement at our SI joints. There's some, but it's almost imperceptible. But that doesn't mean that there can't be irritation there. There's a lot of different theories on why we hurt back in our SI joints, but today I'm going to try to do a little video to help with just some feel-good movements to try to calm that down. Now, I also am having some low back pain because I have been doing a little more exercising now that I don't have as much going on outside of work and home. And this weekend we taught our twin girls how to ride their bikes without training wheels, which meant I was in a hunched over position for multiple hours over the weekend, running after them and running beside them and trying to keep them from getting hurt. So my low back is bothering me, so I'm gonna make this a little bit also about the lumbar spine, and I'm gonna do some things that I know are gonna feel good to me, and hopefully they will help you as well. So I'm gonna start on my back first, and I'm gonna do some breathing. Okay, so in through my nose, out through my mouth, allowing my belly to gently rise on my inhale and drop on the exhale. And look how quiet the hand on my chest is. It's not moving much. Okay, so we're just giving our core a little bit of movement. Now, I am not smushed against my yoga mat right now, but I'm also not super arched. I can't get a Matchbox car underneath my back. I'm in neutral spine. I'm somewhere in between. As I breathe. And now I'm going to do some transversus abdominis activation. So some deep core activation. So I'm going to inhale to prepare. And as I exhale, I'm drawing my belly gently in. I'm letting it go on the exhale. On the inhale, and then I'm drawing in on the exhale. If I feel right inside my hip bones, as I breathe out, I can feel a gentle firmness under my fingers of that muscle activating. It's almost as if I could bring my hip bones closer together. Notice how I'm letting my belly go every time I inhale. And then I'm drawing in. I'm hugging my belly on the exhale. And look, you don't see anything else moving. Okay, so it's not a butt squeeze, it's not a pelvic tilt, it's a drawing in of my abdominal wall. And now I'm going to do some marches. I'm going to inhale, exhale, inhale, let it go, exhale, drawing in. Inhale as I lower, exhale as I march. Inhale as I lower, exhale, marching, drawing that belly in and flat. going at your own pace. If this is too fast, slow it down. I don't want you to get lightheaded. I certainly don't want anybody passing out on me. We're just engaging that deep core. Good. And now, coming into tabletop, knees over your hips, okay? I don't really care what you do with your feet here, okay? So, I'm inhaling, I'm letting go of any core tension on my inhale. I'm exhaling, drawing my belly in as I lower my heel to the ground. Exhale as I lower. Inhale as I lift. Exhale as I lower. Inhale as I lift. Again, I am not smushing my back into the mat, but I'm also not letting myself arch excessively every time I do this. That's what this muscle is doing. It's sort of keeping me in this nice neutral spine. Fill the belly as you inhale. Draw in as you exhale and lower. So I'm really feeling this all in mostly my lower abdominal wall. Good. Okay. Now, I'm going to flip over. I'm going to rest on the mat, and I'm going to do one more abdominal activation, okay? So we're going to imagine that there's a grape under our belly buttons, and that we have to make room for the grape as we breathe out. So inhale to prepare. Exhale. Draw the lower belly gently away from the mat. Inhale, let your belly drop into the mat. Exhale, draw the lower belly gently away. Now look, I'm not moving my low back. I'm not doing this. I'm not squeezing my butt. I'm not lifting here. Okay, this is not what I want. If you can see yourself moving a whole lot, then you're using other muscles. It's all coming from right under here. You can't see much going on, but that's what I want. Inhale, let the belly relax into the mat. Exhale, gently draw the belly away. Let's go one more time. Good. Okay. And now we're going to do some stretches. Okay. So I really need a hamstring stretch. Hamstrings attach from just below your knee joint. They come up and they attach to different places on your hip bone, specifically your sits bone, so that bone that is in contact with the chair when you're sitting all day. So it can certainly impact your low back because it's going to pull our pelvis into maybe a tilt or a tip that it doesn't really want to be in, and that's going to impact your SI joint certainly and your low back. So my goal is not necessarily to get my legs straight here. I'm reaching my heel up towards the ceiling. If that's too much, you're going to bend that opposite knee, okay? And you're going to take those nice belly breaths, just trying to relax your neck, your shoulders into the mat. So we're not here today. We're just very gently letting our hamstrings stretch. You're gonna switch sides. This side is way tighter. Can you see that? That's okay. I'm not forcing it today. I'm letting it be. I'm okay with that. Good, and breathing. Now, ideally, I would do this a couple more times. So if you want to pause and do it a couple more times on each leg, that's really great. That would be ideal. But for now, I'm just going to do each of these once. Now we're doing figure 4 stretch. So cross your right leg over your left knee, grab behind your left knee, look at my neck and shoulders. I am relaxed, okay? I am not here. If you need to use a towel or a strap for any of these, grab one and hold on to it here, okay? Make it easy on your neck. Breathe. You want to feel the stretch in the back of the bent or the crossed over leg, okay? And again, do what feels good with that bottom leg. And then switch. This is a piriformis stretch. Our piriformis muscle attaches to our sacrum, which is that triangular muscle at the bottom of our spine, and to our hip. So this is a really big player in some SI joint dysfunction and in lower back dysfunction. So this is a biggie. So again, gosh, my left hip is way tighter. Ideally, you want to do this a couple more times on each side to really get good stretching. Okay, coming up, let's go into half kneeling. Left leg forward, right leg on the ground. Watch my pelvis, okay? I'm going here. I'm tucking my tail under, and then you can lean forward just a bit. Ideally, you're not necessarily here, okay? If you're getting a good pelvic tuck, you're probably gonna go ahead and you're probably already feeling it, okay? Look at my posture, I'm nice and tall. And I'm breathing, okay? Feeling it all in the front of my right thigh. Okay, now when I switch legs, I'm going to show it to you from the front. Okay, I'm going to tuck. I'm doing a pelvic tilt. I'm tucking forward. I'm gently lunging into my right leg slightly, but I'm feeling it all into my left leg. You might feel it up here, you might feel it in the middle of your thigh, you might even feel it down by your knee. The quad muscle crosses the hip joint and the knee joint. Our hip flexor is up here, so you might feel it in any of those places, and that's fine. I'm nice and straight. I'm going to turn. Y'all stay where you are. I'm turning. Look at my posture. I'm nice and straight. I'm not leaning way back. I'm also not lunging forward. Okay, the crown of my head is reaching towards the ceiling. Again, do this a couple of times on each side if it feels okay. If you have knee problems that keep you from being able to get on the ground, I know my head is a little bit cut off, but you can do standing quad stretch. Look at how my knee is in line with my other knee. So I'm not here. I'm not back here. I'm right in line. So my thighs are almost parallel, and look at my posture. I'm standing nice and straight. Okay, I'm not hinging forward. I'm not doing some funky backwards lean. I'm nice and straight, and if you want a little more of a hip stretch, tuck that tailbone under. Okay, and breathe. Don't forget to breathe. I'll show it to you right over here. Okay, getting my thighs parallel, getting my little pelvic tilt, standing up nice and tall. Okay, so you'll do that a couple times on each side, and now I'm gonna go into a downward facing dog somewhat awkwardly. I'm gonna get a nice hamstring stretch here. My palms are reaching towards the mat, my heels are reaching towards the mat, my chest is reaching towards my thighs, my hips are reaching up into the air. Look, my heels are not touching the mat. That's cool, okay? Don't be a hero. We don't need to touch the mat. It's all good. Okay, just feel a stretch in your hamstrings, maybe even your calves. My calves are very tight today, so I'm feeling that. And now, dropping down into a child's pose. And you can stay here. You can walk your hands to each side. So I really am getting a nice lat stretch here, all through my left side body. Okay. And your lat muscles, those are a big muscle in the back of your shoulders and mid back. They actually attach to your sacrum, okay? The fascia does. So that can be helpful when you have low back or SI dysfunction. And I'm breathing. I feel my belly gently moving into my thighs. Okay, and then you can walk to the other side. So here I'm feeling this whole side stretching. This is not my tighter side. My left side is so tight this week. But you can hang out wherever feels good, and if that's here, that's okay. If that's here, listen to what your body needs. That is where I'm gonna stop today. It's just a nice little overview. So we've gotten the deep core muscles turning on. We've gotten some lower body stretching. Feel free to repeat as needed, or like I said, pause the video and do those stretches a few times through before you move on. And hopefully that will give you a little bit of relief from your low back SI pain. If there's anything specific you want to hear about or any specific questions you want me to go over, definitely leave it in the comments or message me, and I'm happy to do another video. I've had a request for some pelvic floor exercises this week, so that's going to be my goal tomorrow, is to do a little 10-minute workout where we incorporate a lot of pelvic floor strengthening. So I'll give you a few exercises that will be good for getting the pelvic floor active, so that you can throw that into your workout at the beginning of your workout, at the end, or just do it when you have a couple of seconds in between serving your kids lunch and tying them back to their desk chair, trying to get them to finish their schoolwork. It's great, y'all. Okay, thank you so much for watching.